All right, today we want to talk about a orthotic adjustment that we're doing on a client's pair of insoles that he brought in. He was having some issues with his IT band on his right hand side. And what we discovered on examination is that he had really high arches. So, his foot is past cavus foot, looks kind of like this. You can see there's a big amount of space underneath here, but there was also a significant amount of space on the outer edge. So if I put, you see a flat kind of surface down there, you have a big gap right here. And that gap causes a lot of instability potentially, especially if the orthotic is not providing proper contouring on that side. And what we notice is that when we're looking at the orthotic, you see this one right here is very rounded at the heel. And then what we found is that when you're tilting it a little bit, it was causing the device to tilt to the outside, causing more stress on the IT band. And what we're trying to do now today is we're going to add an arch fill on there. And that's basically filling in the arch so that the device is stable when you push on the edge, so that a foot is more stabilized when he's walking. And as a result, there's less pain and stress on the IT band, which has been causing him discomfort on the outside edge of his knee, as well as into the hip area. The other thing that he was noticing also was a little bit more stress on his knees. Now that's not surprising because of the fact that he has really high arches. These are rigid arches. They don't really drop very much, even when he's standing. So when he's weight bearing, most of the weight is obviously going to be on the heel and the ball of the foot, but he doesn't have a good shock absorption in his arch because of the fact that his arch doesn't really collapse. So as a result, there's no pronation really going on, and he's really more of a supinator, standing more on the outside of his foot. And what we're trying to do is rebalance the supination and then give him some extra cushioning and shock absorption on top of the device so that he has more cushioning that is going to reduce stress on his ankle, knee, and hip joints. That's it now with regards to us recovering this orthotic. As you can see, there's a new top cover on it. It's got a memory foam cover with some extra cushioning. We can't make it too thick because depending on the footwear that the client is putting it into, there won't be enough space to accommodate a really thick cover. So we tried to keep it the insole thickness of an average shoe. And then we added that lateral support on the outside right here, which is basically a stabilizing tool to provide more stability for the orthotic itself, so that as the client steps onto that edge right here, the device doesn't tilt and it stays nice and stable inside the shoe. Now, if you have any questions regarding this video, please post your questions below. Or if you have any suggestions or comments, do post those below as well. And if you haven't subscribed to us yet on YouTube, please do. I believe it's right in the corner over there. Have an amazing day.